And good afternoon, Santa Clarita. This is Tom Burton coming to you remotely today, if it sounds a little different coming through the phones, from the San Fernando Valley area. Really appreciate the opportunity for KHTS to be able to have us on each month, third Wednesday of every month, to bring Providence Holy Cross Medical Center to the Santa Clarita Valley. Shockingly enough, probably 30%, if not more, of our employees are from Santa Clarita. More than 30% of our patients actually come from Santa Clarita. And so it seems like an obvious thing that we want to be able to reach out further so that way we can better support the communities that support the hospital. Take a look around Santa Clarita, and you're going to see the Providence name popping up, billboards, buildings. A number of our experts and specialists are slowly making their way out into the Santa Clarita Valley to try to help meet the needs of all of our Santa Clarita residents. And, Holy Cross itself has been extremely busy and extremely supportive in trying to make sure that the Santa Clarita Valley as well as the San Fernando Valley is getting the most and best care that can be available. And this can be really obvious when you take a look and see who we're actually partnering with. City of Hope, working with our cancer patients, being able to bring City of Hope and the skills of their cancer care to the San Fernando Valley and to the Santa Clarita Valley, which will make it much more convenient for any of our residents in Santa Clarita who need to receive specialized oncology care to be able to receive it in their backyard as opposed to having to make that commute out to Duarte. We're trying to, as part of our mission and part of our values say with Providence Holy Cross, we're going to do our best to try to ease your way and also the way of your family. So that being said, we're going to try to make it more convenient to you. So City of Hope, one of our partners, also Children's Hospital LA, we are so fortunate to be able to partner with them in bringing 24-hour care in our neonatal ICU, which is an enormous benefit, as that isn't often available at any other hospital in the San Fernando Valley. So that way we can better care for your kids and your babies when the need actually arises. We also are partnering with EXER, okay? So most of our, we get sick, we end up going to an urgent care. And urgent care has its limitations. However, with EXER, which you can find over on the Old Road in the Staples Shopping Center there, EXER actually is staffed with board-certified emergency room physicians. So they've actually upped the care that will be available. However, it's as convenient as using an urgent care. And for the most part, they take most of the insurances that are used in Santa Clarita. So we cannot be any more excited to know that we can have 9 a.m. to 9 p.m., 24-hour, 7-day-a-week care with EXER to not only help out with general illness, but also as we push through the summer into our fall sports time, all of our athletes to be able to get top-notch care, imaging, everything can be done right there on site. So those are just a few instances on how we're trying to do the best that we can to deliver the best care that we can to our communities, which definitely includes Santa Clarita. You're listening to us again live, 12:20 a.m. and 98.1 FM, KHTS. And if just in case, now you can always hear us anywhere you go if you were to go ahead and put it on the app. The app is available both for your Android as well as for your iPhone. However, here we can actually come to you, it seems like, from wherever by utilizing the systems, and we certainly appreciate the flexibility of the KHTS staff to allow this show to be able to be done in the way that we're going to be doing it. And I'll tell you, we are excited because with Providence, 51 hospitals, 114,000 caregivers, 24,000 doctors, 38,000 nurses. Providence Health System is an extremely large health system, and each of their hospitals carry their own specialties. And, I'm very excited because in my role as the Director of Orthopedics and Sports Medicine for the Southern California region, as well as the Orthopedic Program Manager for Holy Cross, that I get a chance to work with some of the best orthopedists that we can be bringing into our hospital. And today we're so lucky because we've been able to bring a couple of new orthopedists to Holy Cross to better support the needs of the community. We have Dr. Nitor, who is here with us today, orthopedic surgeon, sports medicine specialist. And Dr. Tor, welcome.
Thank you, Tom, for having me today.
Yeah, absolutely glad to have you. Dr. Tor comes to us. He's been practicing in the Westlake area with Providence, Tarzana as well. And his great work that's been being done at Tarzana has been so recognized by some of our local insurances and also by the ministry that we feel we need to have his skill set joining us at the hospital as well. And so just within the last couple of months, Dr. Tor has made his way up and is getting busier. And my suspicion is with the fall sports coming on, you're going to start getting busier, right?
Yeah, and that's the hope. And it's this time of the year that we get busier and busier as more and more kids are getting involved in the fall sports. They're having, the requirements to get their pre-participation physicals, as well as, kind of gauging what their parents' requirements for their kids are as well as the school year starts.
Oh, it's going to be very busy, and I think we can start talking about this now. Providence has created a sports medicine program that will be available in the Valley, San Fernando Valley primarily, and then we'll be extending it out over the next couple of years, where we will be having athletic trainers going to the high schools, set high schools, where we're going to be able to be the sports medicine provider for those high schools, all sports. And we're going to do something different. We're going to actually have trainers that will be working full-time, working in conjunction with our physicians, Providence physicians who will be helping out with the schools. And, we're really excited because those trainers are going to be doing treatment. They're going to be doing field care. They're going to be doing aftercare, as opposed to where in a lot of cases they're responsible for a level of curriculum and then they do athletic training. And so hopefully to better support, and you're right, we've got a lot coming up between pre-participation physicals. We've got, I believe, football is going to be going to practice officially for some of the schools within the next week or two.
Yeah, and it's glad to hear, Tom, that we're putting a great emphasis on, having trainer and physician involvement early on and present and easily accessible. More and more, we're seeing that, injury prevention and safety is got to be our number one goal for our kids. And starting at an early age, whether it's, from high school as they get into their college sports involvement. And one thing to know is a good prognosis for any sort of injury is injury prevention in itself. And I think that's, a great goal to have right
now. It's interesting that you say that because the one of the things that we're looking at is being able to have a documentation system where we're working with the kids. And part of that is to be able to do trending and taking a look at the variety of different injuries that may occur, maybe hopefully get to a little bit of predictability. And if we can predict certain injuries because we're seeing these trends, there's a real strong chance that we can prevent, based off of surfaces, maybe equipment, technique, maybe training technique, how we're actually getting our kids ready to participate. So, the role of the physician in this is going to be tantamount. And you have great experience. Now, tell me about some of the teams that you've had the opportunity to work with and continue to work with.
Yeah, I've been fortunate enough. I did my sports medicine and shoulder fellowship at Curlin Jobe Orthopedic Clinic here in Los Angeles. And with that fellowship, I was fortunate enough to serve as a team physician for many of the local professional teams, including the Dodgers, the Lakers, as well as our two hockey teams, the Los Angeles Kings and Ducks as well. So it was, quite an experience, and we all know the demands that these professional athletes have, and the risk of injury that these athletes have. So it's a great experience to know what these athletes are doing in regards to one, injury prevention, and one, how these athletes are being treated on a daily basis. And that's not only from a physician perspective, from a therapist perspective, or with our chiropractor stream. It's the all the multi-specialty treatment that is paramount to getting a good result for each and one of these athletes.
Yeah, it's 100% true, and I'll tell you, it's so interesting. You touched on a few different things. Is that one is it is about care, and it's not just waiting for somebody to get hurt. A lot of it is pre-work. A lot of it is post-work, the post-workout care, the post-competition care. So important, in that being able to treat that athlete like you would treat a classic car. There's a lot of work that goes into it. In prepping it to be able to be driven, as well as taking care of it while it's being driven, and the care that you would take after you finish driving it to assure that the next time it goes to get used, it's going to be able to do the things that you are hoping that it's going to be able to do. There's a lot of work that's involved, and I'm sure you had the opportunity to witness that.
Yeah, absolutely. And, we think about the various injuries you see that are common in sports, such as football. You see ACL tears, you see shoulder dislocations, and we have to see what are we doing to prevent this in the first place. So you take a look at a patient, and we have to know, do they have the proper conditioning involved that limits their risk from, for example, having an ACL tear occur? Do they have the proper quadriceps conditioning? Do they have the proprioception there? Have they had previous surgeries before? These are things that we always ask the athletes or a patient, because that allows us to know what we need to do so that this doesn't happen before. And again, with high school football, it's not just rehab, being conditioned. We're more focused also on do they have the adequate protection? Do they have padding? Do they have helmets that are well fitted? All that kind of comes in together to ensure that we are doing everything possible to prevent one of these classic injuries that we are so common to hearing.
And are they healthy enough?
Yes.
Yeah, that's one of the other things too. Is that though with covering sports, there are the orthopedic injuries which you're going to be an expert in taking care of. But there is I would probably say an equal percentage, if not more, of medical-related issues that we may have to address, whether it be just general wound care, if it's going to be illnesses, skin conditions, dental-related injuries, to working with our female patients, where we might have an issue with maybe like with the triad of issues that can occur if they're overtrained, undernourished, and the variety of changes that can occur to their body. That all of these things we're going to be taking a look at, as well as just the orthopedic issues. And there's a lot involved.
Yeah, and that's a good point. Sports medicine is not just, structural injuries of the knee, hip, or shoulder. We have to take a look at, do they have the proper nutrition, diet involved in their kind of daily lifestyle? Are they getting adequate amount of sleep as well, so that their muscles have enough time to recharge for the next day, for the next practice, for the next game? Finally, one of the other things in sports medicine that we don't always think about in orthopedic surgery is concussion treatment. We hear that so much from the NFL and in the media. And, all of it, it's a good thing, because now we're putting more and more stress on concussion prevention, concussion treatment on the high school level, because we all know that these type of injuries, especially at a younger age, can have a profound effect later in life as well.
That is absolutely 100% true, and which is one of the reasons why Providence has stepped in and is doing impact baseline testing, and looking forward to be able to continue testing and keeping an eye on all of our athletes, and soon maybe even all of our students. For that matter, because one of the shocking numbers that we saw is though with sports we see a lot of concussion, the number of students who are not athletes who end up with concussions is it outweighs them probably 2 to 1, which is a big number.
Yeah, and it's interesting that concussion unfortunately, is the fact that sometimes it can be missed because sometimes the kids don't know what their symptoms are. They they feel like they're able to play. Sometimes families get involved, and there's a little bit of pressure to play. We as trainers and physicians need to know when a player may have symptoms of pressure, and when it's just safe to put the player out of the game, and to follow that. So I like this whole goal that each high school, Providence is making a good effort to have coverage, and someone right there and ready to treat these players.
So that kind of brings in the next question then is, so early on, before you even got into college, did you make the mental decision that you wanted to be a physician and an orthopedic surgeon?
Yeah, so, I look back and I ask myself, when did I actually figure out I want to be a doctor? And it was early on. I am raised in Southern California. I went to high school in Reseda High School in the San Fernando Valley. And it was more in my undergraduate days at UCLA, where everyone has this sort of pressure now to pick out what field are they going to go into. When you look at your strengths and you look at what you want out of life, what rewards you, and after various volunteering activities, finding out my strengths more of it lied in the medicine sciences, I was drawn into the field of medicine. And it obviously provided me for a pathway for helping people, and that was something that was rewarding to me, a way to get gratification out of doing the things daily life. But I had no idea I wanted to go to orthopedic until I went to medical school. That's where you're exposed to the different fields, whether it's pediatrics, internal medicine, OB-GYN. And it was more the fact that I could help people by surgically treating them and watching my results and hearing the results directly from my patients saying, yes, they're better. They're able to perform this activity now with less pain, with more strength. The fact that, I now have an opportunity to give these people the quality of life that they want and deserve, that's particularly rewarding. It's something that I enjoy and I'm glad to have at this point in my life.
Absolutely powerful, and it is a tremendous reward to be able to visually see those changes, and it's because of the work that you do. I know that back at the studio, they're itching to go ahead and go to a break, so I'm going to go ahead and invite you all back in the next few minutes to be able to join us for our next segment with Dr. Tour. You're here with us with the Providence Holy Cross Health Hour on KHTS, 1220 a.m. We'll see you in just a few minutes.
Your hometown station.
Our news team at KHTS is constantly working to keep you informed. If you want the latest and greatest information on the Santa Clarita Valley, just sign up for the KHTS newsletter. SCV News delivered directly to your email inbox every weekday by 5 p.m. and a special weekend edition on Sundays. All it takes is an email address and you're set. Go to hometownstation.com to register.
98.1 FM and AM 1220.
The best live theater can be found right here in the Santa Clarita Valley. The Canyon Theater Guild has been entertaining audiences for decades with top quality musicals and plays. Located on Main Street in Old Town Newhall, CTG also offers workshops for the young actor in your family. For more information, call the box office at 799-2702 or go online to canyontheater.org.
La Esmeralda is home to truly authentic Mexican food. This family-owned restaurant prides itself on its fresh-to-order menu. Even the tortillas are made in-house. If you have a taste for sizzling fajitas, flautas, or menudo, you have to try La Esmeralda's Mexican and seafood restaurant. Dine in or order out for the most authentic Mexican food Santa Clarita has to offer. Their Taco Tuesday, it'll turn you into a regular. La Esmeralda on Bouquet at Haskell.
Accesso Technology is holding an interview event on August 3rd, 4th, and 5th at Westfield Valencia Town Center. You'll have an opportunity to support Accesso's award-winning ride queuing solution. We're hiring 65-plus entry-level cashiers and ride attendants to work on-site at the Flash Pass operations at Six Flags Magic Mountain. Enjoy flexible hours and free park passes on your days off. Apply now at summerparkjobs.com. Meet our team at the Westfield Valencia Town Center the first weekend of August. Who said work can't be fun?
Your hometown station.
Doctor, give me the news. I've got a bad case of loving you. No pills gonna cure my
And welcome back, Santa Clarita. This is Tom Burton, the Orthopedic Program Manager and Director of Orthopedics and Sports Medicine for the Southern California region with Providence Holy Cross Health Hour, coming to you remotely. Thank you so much to the KHTS family for allowing this opportunity to be able to do this from outside of the studio. And we are joined today by orthopedic surgeon extraordinaire, Dr. Tor, and he just got finished going. And, you know, of course, for those who have been listening to the show, realize that I was smiling inside very nicely when he mentioned UCLA. Which is near and dear to my heart. I went to UCLA. My son graduated from UCLA, and I'm pleasantly employed by Pac-12 in assisting with the UCLA on occasion. So, we'll throw that a clap out there. But, you got into orthopedics. You're specializing in sports medicine. And now that sports medicine specialty, it's a little different than what we would see with primary care, right?
Yeah, absolutely. Yes, the sports medicine, even in itself, is can be specialized into different categories. And we have our primary care sports medicine physicians who we closely work with, and they're very good about taking care of mainly our non-operative and medical issues that are related to many of our sports injuries. And then it's the other half of sports medicine is the surgical side. And that doesn't necessarily mean that every patient I see needs surgery. It's a matter of fact that, a lot of patients that we see have structural injuries to whichever joint, whether it's the knee, shoulder, hip, and there needs to be a consultation with an orthopedic surgeon, sports medicine specialist who can better assess the degree of injury and whether or not certain conservative management involving specific physical therapy would be needed, or whether a surgical treatment would be the best treatment option. Because we have to ask what our goals are. And our goals are, one, of course, pain, as every patient comes in having. And number two, to get the patient back to their prior level of activity. And that is where we rely on our literature, on our training, to assess what is the best path for this patient to take to get them to their prior level of function, to get them back their strength, to get back their range of motion. And, in a lot of ways, depending on the treatment aspect, surgery is the better option for certain level of injury.
And I greatly appreciate the fact that you said to return people back to their previous level of function. And the reason why I found that to be so intriguing is that you don't have to be an athlete to see an orthopedist who is a sports medicine specialist. It's not a requirement to be an athlete. It's an approach that you will take that will allow anybody who comes to see you that opportunity to be able to get back to their prior level of function, a quality of life, if you will.
Yeah, and that's absolutely true. And I have to say, most of my patients are not everyday athletes. Most of my patients are, they can be the average couch potato, or they can be, just a weekend warrior. But we have to realize that living in our society, we have to have some level of activity to live a healthy life. Our goal is to have a healthy body and live a long life. And to get that, we have to, each and every person, no matter who they are, should integrate a certain level of activity to their daily lives, whether integrating that along with exercise, whether it's once a week, twice a week, 3 times a week. And because of that, everyone is at risk for some level of injury. So it's our job to see these patients. They're not all athletes, and we take that with a grain of salt, and we assess their goals and what they want to get into, and treat them based on that.
It's absolutely amazing when you have the opportunity to be able to work alongside with physicians such as yourself. The opportunity to be able to see the ability to assess the confidence that you can give to your patients, and that it is 100% true. 30 years ago when I first started practice, if you went to the orthopedic surgeon, oftentimes it was a hammer looking for a nail. But nowadays it's really not that anymore. It is truly what is going to be the best avenue to get you back to whatever it is that you want to be able to do safely. And there in certain times it can be surgery. However, the surgeries that you do, they're pretty specific. They're minimally invasive, oftentimes arthroscopic.
Yeah, most of the surgeries specifically related to sports injuries is arthroscopic, like you said, and these are minimally invasive surgeries with tiny incisions, for example, around the shoulder or knee or hip. And we go into the joint with camera and certain instruments. And say, for example, I'm treating someone with a rotator cuff tear, which is the main set of muscles around your shoulder. And a lot of times in the middle-aged patient, someone who's active, does a lot of overhead motion, is prone to having first rotator cuff tendinitis, which could potentially lead to a tear. And if that tear necessitates surgery, we can do it with minimally invasive methods, which in the grand scheme of things puts lower risk to the patient, less complications, and faster recovery. Most of these types of surgeries are outpatient surgery. They go home the same day. I see them back in about 7 to 10 days after the surgery date, and we start immediate physical therapy. We're having these patients begin ranging their shoulder, ranging their knees, starting the range of motion and strengthening protocols. And yes, I tell all these patients that there is a level of rehab involved. If it's a rotator cuff repair, they're going to be in a sling for 6 weeks. That rotator cuff will heal. And then we start, ramping up the therapy protocol. If it's a simple knee arthroscopy, where we go into the knee and clean out a torn meniscus, we're getting these patients active right away. We start therapy, motion, they're walking on their feet. They may need crutches the first couple days. But these type of protocols, these type of minimally invasive methods ensure that the patient is more satisfied and leads to a quicker recovery.
Yeah, it's you mentioned it before. One of the biggest key indicators is patients having pain, and when you can go minimally invasive, you can cut down the amount of soft tissue trauma that occurs as opposed to a full open procedure. You're decreasing risks for infection. You're decreasing that post-surgery trauma, the pain that would go with that. It is 100% true, and I appreciated the fact that there is a level of physiology that still has to occur. So yes, we can repair a rotator cuff. However, the structural repair itself, where it begins to scar itself over and such, that still has to happen, and that we can't really rush that. We have to appreciate it. We have to respect it, and we can progress with it based off of the tolerances.
Yeah, and that's absolutely true. Surgery is just one aspect. We can put strong anchors, we can put strong sutures, put that rotator cuff down, back anchored down to the bone. But if that doesn't heal, then there's no point in having that done. So we have to make sure, one of the things in sports medicine that we're looking into more and more is the biology. Are they going to have adequate healing of the rotator cuff tendon back down to the bone? That's why during the surgery, we also make sure that there is adequate bleeding bone where we anchor the tendon down, so that there's a better opportunity for that tendon to heal down with better biology and stronger fixation down the line. And because of that, we need the body to let itself heal, and that doesn't happen overnight. So there is an element of immobilization and waiting until healing occurs before we can start the rehab process.
And then now that said, I think one of the interesting things, especially when you were working with the sports teams when you were over K&J, one of the pieces, though, is though the shoulder may be immobilized, all of the work that athlete did regarding their cardiovascular, their legs, and their generalized strength, that all still exists, and that has to be maintained because eventually when they're capable of being able to go back into competition, that not only is the area that had surgery has to be ready to go, but their entire body has to be ready to go. And during that 6 weeks maybe of immobilization, they can still focus on those other areas. Is that right?
Yeah, that's absolutely right. I mean, when we've done ACL reconstructions for professional athletes, yes, there's a period of mobilization with their knee brace, their leg locked in full extension. But one of the goals is we have to try to maintain their conditioning that they've worked all their life to get into. And if there is immobilization with no, say, isometric exercises, no conditioning exercise involved, their quadriceps is going to atrophy. It's going to become smaller. They're going to lose some of that conditioning. And that's why we work closely with our therapists, work closely to come up with evidence-based physical therapy protocols to ensure that we're still maintaining the conditioning to their quadriceps, the overall dynamic muscular balance that we hope to create and stay in these patients' bodies. And one of the other things to keep in mind is this is why athletes and the normal patient, the weekend warrior, are less active patients. It takes a year before they're back to some of the sports they want to get back into because we don't want to risk re-injury within a year of their surgery. And one of the things I always mention to patients is, yes, the surgery may be done and the graft may be healed, but your muscles are nowhere near ready to go back into competition. And that's why it's a roughly 8 to 12-month process after, for example, an ACL reconstruction.
Yep, so there's functional testing, there's isokinetic testing that gets taken place that allows us the opportunity to be able to see the ratios of strength compared to their non-operative leg as well as their operative leg, and to see what they can and can't do, because if there's a huge disparity, that can create a level of compensation. That compensation could absolutely put the graft that maybe you did in jeopardy.
Yeah, that's absolutely right. During my time at Curl and Job, of course, they had all the high-tech machines where they can absolutely quantify what their quadriceps strength was, what their range of motion was. But, realistically said, you don't need those high-tech machines to know what their strength is. We always evaluate the contralateral, the other leg, the other shoulder, to know what their baseline function is, what their baseline strength is. And, just a kind of a rule of thumb, a person is not ready to go back into competition if their strength or range of motion is not symmetric to the other leg or the other shoulder. And, it doesn't have to be 100%, but within 80 to 90% of the contralateral exam.
Yeah, now that is great numbers and great advice on that, because that is 100% true, and that's one of the reasons too where we start running into that question is, when will I be able to return to play? When will I be able to return to play? And though returning to play is important, the advice oftentimes we'll try to give is that we can get you back into the game, but we want you to be able to stay in the game. And there's no use putting at risk, because that second surgery to repair it, is it going to be as good as the first?
Yeah, and that's a good point. The first question, and if I had myself ACL reconstruction, my first question was, okay, when can I get back to work? When can I go back to basketball? Everyone wants to know, and these are valid questions. The one thing to keep in mind is everyone is different. Everyone is different. There's no, reason to it. Everyone's biology, bodies are built differently. So there's no one answer. So our job is to give rough guidelines. For example, with ACL reconstruction, I tell them they're able to walk with their brace right away. Yes, jogging to running straight, that may take 3 to 4 months. Now, when we're looking at pivoting motion, certain activities left to the right that require turning of the knee, that may take 5 to 6 months. And then after that, now we have to integrate when are they ready to go back into contact sports, because that's a whole different ball game. That may take another couple months on top of that. And we evaluate the patient. We talk to the therapists, their high school football coaches. We want the patient to be comfortable with what their treatment plan is. No one likes to hear, no, you cannot go back into the game. You cannot do this unless they know exactly why and what the reasoning is. So we evaluate what they're doing in practices and what they're able to do and what they're able to not to do. And once the athletes and our kids know and see what they're able to do themselves, they're more comfortable with the plan itself.
Communication, novel, yeah. Very, very novel. The that open line of communication, and a lot of times, I'm sure you probably see this in the office, is that nobody ever comes with questions, and sometimes getting those questions is extremely valuable because it allows you to give them the necessary information, as you were just saying, but to be able to have that conversation, which can be difficult, but on the same token, though, is that when you have somebody such as yourself who is extremely astute not only in diagnosing but also in putting together a plan of care that will allow that patient to be able to reach their goals, you're also going to what I hear is there is an end point, and it's not like, now this is one of the things that we do run into during the season is that we do want our athletes, our friends, our families to be evaluated by the appropriate person to get a plan of care that is going to best benefit, and that just throwing an immobilizer on for 6 weeks and then returning back to play, without having that oversight, that may not be the best of idea, and that having that communication with your physician, with your specialist, may be probably one of the most important conversations you can have.
Yeah, and that's absolutely true. One of the things is you may not know what to ask, and that's perfectly normal. And that's why, when I have my clinics and I speak to every patient individually, I like to ask multiple times, do you have any questions? And I like to kind of further that by asking, okay, what are your goals? Are you going to go back to work? When is your fall season of the sports going to start? Are you going to play summer? Because that allows them to think forward to see what their goals are going to be, and then that's when the questions start popping up. Otherwise, I'm going to get calls 2 weeks later, I had this question, which is perfectly fine, but every patient likes to have their questions answered right there in front of the doctor. I like to have that done. Because we all know, we all have questions, we all want to know forward-thinking what we plan and what we can expect to have.
That is perfect, and I know we have a few more minutes before we have to go to our next break, but so you mentioned something. So your summer program, your winter program, what is your thought on single sport, 12-month-a-year athletes?
Well, one of the things is it has become more and more prevalent where kids are involved in 12-month sports where they are playing year-round. And what we're seeing more and more in clinics are these overuse type injuries, whether it's little leaguer shoulder from a pitcher that's pitching year-round to Osgood-Schlatter's disease, where they're having anterior knee pain from playing soccer all year round. One of the things I try to emphasize is, and this is a discussion with the family as well, is to integrate a rest period, whether it's during the summer, even if it's for 2 to 3 weeks. These type of breaks periodically during the 12-month period is so important because we all know that kids are still growing. Their physes, or what we call their growth plates, are still growing, and that is the area of the bone that is more prone to injury as compared to an adult where the growth plates are closed. So more and more, especially in the baseball sport, we're trying to encourage pitching counts to make sure we know how many pitches this kid is throwing and for how long, what time, how many innings did this person. But we have to keep track of this because there is a point of overload. This is why we see so much prevalence of Tommy John surgery in Major League Baseball. It's because it's the ligament in our elbow, the ulnar collateral ligament, was just not designed to take that sort of load for that long of a period. So we need to give our body the proper amount of rest during this period. I mean, there's no way around it. We can't say you shouldn't play your kid for 12 months. We just can't do it. We have to accept that. But then there are, compromises that we need to make with families and their goals to ensure that none of these injuries arise.
That's perfect. Yeah, it's extremely valuable, and I know this is something we touch on every time we were lucky enough to have an orthopedist with us on air. Now, we're going to be going to break right now. You're with the Providence Holy Cross Health Hour. That was Dr. Tour speaking. I'm Tom Burton from Holy Cross. You're on KHTS 1220 AM, your hometown station. We will talk with you in just a few minutes.
Daily Imprints is the premier one-stop shop for custom embroidery, screen printing, and promotional products in the Santa Clarita Valley. Owners Joe and Dana have provided KHTS with quality embroidered company shirts for over 3 years. If it's new business cards or promotional products you need to enhance your image, Daily Imprints is the choice for you. Located on Lyons Avenue, stop by or call today, 661-678-0508.
Did you know that nearly 1 in 3 women will experience domestic violence in her lifetime? And in Santa Clarita, our community supports its own domestic violence center with a shelter home, 24-hour crisis hotline, and bilingual counseling programs. If you or someone you know needs help, we're here. The 24-hour crisis hotline number is 259-HELP. For more information, go to dvcsantaclarita.com because no one should tolerate domestic violence. 259-HELP.
This is a Rita's Daybreak. There's a huge crowd at Rita's. With so many amazing flavors, every day's a treat. Let's see what folks are celebrating.
I lost my first tooth.
No more training wheels.
My dog photo got 37 likes.
3 kids, 3 activities, 0 meltdowns. There you have it. Layer it, blend it, or drink it with Italian ice and creamy custard. So many reasons to celebrate at Rita's. This has been a Rita's Daybreak.
Hey there, I'm Tori with your hometown station weather. Partly cloudy today with a high of 98 degrees, clear overnight, and a low of 72. More of the same most of the week with temperatures almost touching 100. For all that's going on in the Santa Clarita Valley, check us out on social media. Like us on Facebook. Follow us on Twitter and Instagram. Or download the free app. Or just go to hometownstation.com.
Doctor, give me the news. I've got a bad case of loving you.
Oh, welcome back, Santa Clarita. I really appreciate you joining us for this last segment as we kind of wrap up our Providence Holy Cross Health Hour for this Wednesday in July. We were joined with Dr. Tour, and thank you so much for taking time out of your clinic, out of your surgery time, to be able to join us. And I'd love to make sure that we can get any of our listeners or anyone that you can think of that would benefit from such expertise. We want to know how we can get a hold of you, get in to see you.
Sure. Well, thanks, Tom, again for having me. It's a great opportunity to kind of, tell our viewers what they can look forward to, what opportunities they have for patient care. So I'd like to tell everyone that they can certainly see me in Mission Hills, right across Holy Cross Hospital. My address there is 11550 Indian Hills Road, Suite 300. And you can always call to make an appointment. The number to call is 818-403-6337. And our practice name is Center for Orthopedic Specialists.
And there's a website as well.
Yes, with the website, you can absolutely see every one of our profiles, kind of gauge what your complaint is, where the pain is, and you can see our physician, because we pretty much cover every specialty. And our website is www.cos-orthopedics.com.
That's great. I do encourage everyone who is listening, take a little bit of time, take a look at the website, familiarize yourself with this group because it is they do a tremendous amount of work, great work, and as Dr. Tour said, they pretty much cover absolutely everything. And we've been lucky enough. We had one of your colleagues on, Dr. Viswanath, last month. And looking forward to having Dr. Rana, a total joint specialist, on in the coming months, which will be great. So that way we can allow everyone the opportunity to get to know what we already know with the brilliance that we get a chance to be surrounded with on a regular basis. So Dr. Tor, thank you so much.
Thank you.
Now, just before we kind of wrap up, we have a few minutes. I wanted to take and just set some time aside. I cannot be any more excited to tell you about the Providence and the SCV. Now, what this is this small subgroup of only Santa Clarita residents who are very prominent supporters of Providence Holy Cross Medical Center, and we're working in conjunction with the Foundation for Providence Holy Cross to try to gain interest, get awareness, and eventually to inspire people who are interested in seeing Holy Cross to continue to proliferate the way that they have been, to become involved. And so the Providence and the SCV, we meet pretty regularly once a month, and we have been so lucky to be able to start planning boutique-type salon events. Recently in May, we did a wonderful one in support of our neonatal ICU, where we are looking to expand, and we're looking to do another event coming up August 16th. We cannot wait for this one. We had probably 70 people show up in May to learn more about our neonatal ICU, meet some of the staff, meet some of our families of patients who have been able to receive care with our NICU, and to actually see what the need is going to be and what our needs are. And we're really hoping to be able to expand, because every so often when we have an awful lot of births and a lot of children that are required to have some time in our NICU, our neonatal ICU, we've started to run out of beds. And so because of that, babies are having to go to specialists outside of Holy Cross while their mother is still recovering at the hospital. And we want to see our babies staying close in proximity to their parents whenever possible. And so this event is going to be a wonderful one coming up in August. Probably the best thing that I can say is August 16th. It's going to be an evening event. And what we're going to ask is we would love for you to RSVP. We would love for you to bring yourselves, bring family, bring friends, so that you can gain a better understanding about Holy Cross, especially with the needs that's going on, particularly right now with our NICU and the needs to be able to expand in beds, and the fundraising efforts that are occurring, and really the reason why in trying to maintain all of our families together in one distinct location. Let me give you a number. It's going to call to our Holy Cross Foundation. It's 818-496-4600. And that's 818-496-4600. And when you speak with someone from the foundation, indicate that you are interested in attending our August 16th event for the Providence and the Santa Clarita Valley in support of our neonatal ICU. We are going to have a number of speakers. I know we haven't completely nailed down all of them, so I don't want to give out the entire agenda, but there might be some of our congressmen and assemblymen there. We're going to have staff. We've got families who have had children in working as patients within our NICU. And it's going to be yet another special event, and it's going to be with all of our Santa Clarita residents and our neighbors in order to try to educate and be able to gain awareness and hopefully be able to create that interest and drive to become involved, whether it be to assist with the Providence and the SCV or even to make a donation. Or how we can get you involved, maybe come down and visit and actually see what we do. So that way you can kind of gain a level of excitement knowing that you have the ability to be a part of something that is so big as the delivery of care to a newborn and to aid in their recovery while their family is right there with them. So I want to thank KHTS, as always. They have been such great supporters of Providence Holy Cross. I want to thank Dr. Tour again for joining us. And I want to thank Santa Clarita as well for joining us on 1220 AM, 98.1 FM on KHTS. And we will see you next month in August, third Wednesday. Have a great rest of July.